Hello, my name is Nicole Bottles. I'm 23 and from Victoria, BC, and a board member of the Lyme Disease Association of British Columbia. And I would like to tell you how I ended up rolling in here today, 8 years after my initial diagnosis. And it all begins with a tick the size of a poppy seed. My story reflects the experience of many Canadians who follow a similar journey: a mysterious illness, multiple specialist visits, extensive lab work, and culminates possibly years later with misdiagnosis or no diagnosis at all. Tragically, delay in treatment gives the Borrelia time to disseminate and making it more difficult, if not downright impossible, to treat and eradicate. In 2008, I was a healthy, straight-A student. I loved my school and choir, hiking and kayaking. It took several months and one tick bite to change all of that. During my grade 10 year, I never recovered from a prolonged flu-like illness. Not having the strength to get out of bed, even for an hour of school, was one of the hardest and scariest realizations of my life. I went downhill very quickly, and within a few months required a wheelchair and experienced intense chronic pain, swollen joints, exhaustion, and severe short-term memory and cognitive impairment. Trips to many specialists and diagnostic tests were fruitless. By chance, we learned about Lyme disease, and the host of seemingly unconnected symptoms made sense. The symptoms I developed were classic manifestation of Lyme disease, and I was so relieved. I thought, now all I have to do is get quick treatment and I'll have my life back. Well, needless to say, 8 years later, it's not that simple. I had a negative Lyme test result, like so many Canadians. And versus making a clinical diagnosis, most doctors rely on this flawed lab test to diagnose Lyme disease. If someone is diagnosed and treated immediately, $100 of antibiotics should see them return to health. The cost of my own treatment has been well over 1,000 times that amount. And I'm one of the lucky ones who was able to seek the guidance of 4 leading US experts. Friends, family, and my community donated at fundraisers to support my treatment outside of the country, which isn't covered by our healthcare plan. A 2006 study from the US CDC by Zhang et al., who we are very fortunate will be speaking later, found that the annual burden of disease, the BOD, when Lyme was treated early was under $1,500 for only 1 year. If the illness was left untreated, developing into a chronic infection, the BOG jumped to $16,000 per year, every year. The cost of being misdiagnosed is astronomical for our healthcare system. The cost to patients could be their lives. Our nation is on the cusp of creating a paradigm shift in the way we confront Lyme disease. And time is ticking as our communities encroach on wildlife habitats and the climate changes, leading to an explosion in the tick population. The National Lyme Disease Framework has the potential to be the catalyst for change. It's already brought us together: patients, advocates, physicians, researchers, public health officials. Through reconciling the 2 standards of care into a workable set of guidelines, we can transform a static situation into a constructive environment for patient care. I could talk about the need to rewrite the diagnostic algorithm, invest in active surveillance, and address the limitations of testing and physician awareness, but the overarching theme echoed today is concise: education, prevention, treatment, and testing. Simple enough in practice to implement. However, patients continually battle a stigma every time we walk into a doctor's office, which is why we need strong leadership and open-mindedness from all of us here in order to move forward. We have been extremely patient. But as more and more Canadians fall ill, our community feels a sense of urgency to ensure that others don't have to experience the devastating effects of not only losing their quality of life, but struggling to receive treatment. We must do better. And we're optimistic that this chance to work together for the well-being of all Canadians will finally commence an era where a walk in the woods is not a debilitating activity. Thank you so much.